Thank you. Masih banyak kenapa?
President of India, that is Florence Nightingale.
So can we start?
Yes, sir. We are live. We can go ahead.
Okay.
Yeah.
So let me, on behalf of
Including amplified. What is it including?
Yeah, let me, on behalf of Association of Healthcare Providers India, welcome and convey greetings on the International Nurses Day, which is held every year on 12th May. And this time the theme is Our Nurses, Our Future. I don't know this theme, Our Future. Actually, nurses are our past, present, and future. All through nurses have been there in the healthcare. In fact, I remember in 1992, when first time, when I went to England on sent by Government of India on training on total quality management as applied to the healthcare. Actually, that is where, I learned what role, the nurses played in the national, I.N.H.S in UK. And then, of course, once I joined Quality Council of India, and, opportunity came to establish the NABH. So I remember that when we were trying to think that who will be in the assessment team. So I thought of following the JCI, where nurse has to be part of the assessment team. But, I got, frequent opinion that nurses in India still are not, mature enough to be part of the assessment team. And, I kept thinking, and ultimately I had to take the decision. And I went by that. No, I said, wherever we are, nurses will be part of it. And I made a condition that clinician, nurse, and administrator will be the part of the assessment team. And I think that really helped us to bring the potential in the nursing staff. And I think the rest is the history, how good, they have been performing all through. Then, of course, in the end of around 2010, we established the team on the empowerment of the nurses. We brought 12 prominent nurses together, and they worked and developed the document on empowerment of the nurses, which actually happened then finally became the certification standard for nursing excellence. And of course, now in the association, we keep working with the government, with the ministry, and the talk on how do we restructure the Indian Nursing Council. A lot of inputs have gone from our side. It is actually getting delayed and delayed. But actually, the way healthcare now is emerging, being technology driven, we have given a lot of inputs now that how the nursing curriculum should be improvised. So they become the able ally of physician. Because somehow I think personally I am very uncomfortable when, after 10 plus 2 plus BSc, the nurses still are known as the staff nurses, or, sometimes they call them bedside nurses. Actually, we are undermining the potential which actually is there. And more so when we have shortage of the clinician, why can't we make them at least 30% clinician, which they are capable? I think our inputs are there with them. Last year, it should have come out the revised curriculum, but hopefully, I think in a year, the current year, something will happen. I was discussing with the President I.N.H.S also recently. So I think anyway, I think that today I will not be speaking. There are too many things to speak, but because when I saw that time is 1 hour and we have panel, I can't imagine the better panel than this. And on top of it, the moderator, General Elizabeth, when she's there, I think I should speak minimum. But except I will convey my thanks to Microlab, because I think year after year, the Nurses Academy of Microlab have been conducting this program for 1 week. And I once again thank them and hand over to Major General Elizabeth to conduct the rest of the program. Welcome, madam.
Thank you. Thank you so much, Dr. Girdhar. And I know that you're one of the strongest advocates for nursing in India. And the experience of nurse assessors in the NABH is an evidence of the value-based services that they can bring. And they have a platform to excel. And I'm sure that in the coming years, that potential will also be drawn. Thank you so much for saying those few words before we start the session. So good afternoon, ladies and gentlemen. Is Vijay there at the background? Vijay?
Yes, ma'am, he is there. He must be there. Yes.
Yeah. Shall I start the session, or do you want Dr. Girdhar to?
No, you please, now it is all yours. You please start.
Okay. So good afternoon, ladies and gentlemen. I'm sure that a number of you are there in the audience, and it will pick up tempo as we start the panel. I can see that there are about 45 participants, and we hope that more would join in. And my heartfelt greetings to all nurses who are attending this panel. Wish you all a very happy Nurses Day. And I would also like to congratulate and appreciate the collaborative initiative in organizing the 12th Labs-AHPI-ANEI CNE. And as Mr. Raja has said, that it's 7 days. This is the culmination of the 7-day CNE, and we are culminating it with the Nurses Day celebration. So my sincere appreciation to all of you for organizing this platform, and my sincere thanks to Captain Ejita, President of ANEI, who invited me to this platform. Now, as you all know, that this year marks the 203rd birth anniversary of Florence Nightingale, and it's on this day, 12th May, that nurses globally celebrate this day as the International Nurses Day. And this is done to honor Florence Nightingale and all the nurses who contribute so immensely to the society. I pay my tribute to the indomitable, unforgettable Florence Nightingale, who was the pioneer of modern nursing and the forerunner of hospital administration. I pay my tribute to each and every nurse in this audience, as well as in our country and globally. I would like to quote Florence Nightingale. This is what she had to say, and I think that sends a very strong message for all nurses. I attribute my success to this. I never gave or took any excuse. Well, to go on to the theme for the International Day, the ICN theme for 2023 is Our Nurses, Our Future. This theme highlights the crucial role that nurses play in shaping the future of healthcare. And ICN aims to raise awareness about the importance of investing in the nursing profession, supporting the nurses worldwide. Also, they aim to address the global health challenges that exist today and to improve healthcare outcomes for people. Now, in light of the lessons learned from the COVID-19 pandemic, ICN highlights the need to prioritize the protection, respect, and value of nurses. This requires action that goes beyond words into meaningful and sustained support for nurses. By working together to realize this vision, we can ensure that nursing continues to play a critical role in building a healthier, more equitable world for all and in achieving the sustainable developmental goals. Today, for this panel, we have 3 senior nurse leaders, and I would like to briefly introduce each one of them for you before we get into the panel. We have Ms. Lovelen Sunil, who is presently the Chief Nursing Officer at Max Healthcare, New Delhi. She has done her diploma in nursing and midwifery from Lady Hardinge, then went on to do her post-basic BSc and has done her MSc in MedSurg from New York in Chennai. She has worked in Max Health, Columbia Asia, and Paris Healthcare. She's a member of the TNAI as well as the Infusion Nurses Society. And she has been awarded the Best Nurse, Best Nursing Supervisor, Consistent Performer, and Best Head of the Department in Columbia Asia Hospital. And I'm sure that her experience, her huge experience in the field of clinical nursing is going to bring a lot of meaning to this panel. The next panelist is Colonel Elizabeth, who was the principal at the College of Nursing in the Naval Hospital at Asvini, Mumbai. She has a total of 35 years of professional experience, of which 10 years is clinical and the remaining years are as a nurse educator. The recent appointment from where she retired was the principal of this college, which I just mentioned. She had been a professor and also a clinical nurse. And she also has cleared her NET exam conducted by the UGC. She is a qualified NQAS external assessor and internal assessor for NABH, and she has numerous research paper publications to her credit in Index Journal, and she is a recipient of the Vice Chief of Army Staff Commendation. I'm sure that she would bring a lot of her experience both in the clinical and in the teaching, giving more purpose and fillip to this cause of our nurses, our future. The next and the last panelist is Karishma, who is presently the Assistant Nursing Superintendent at Apollo Hospital, Guwahati. She did her graduation from Army Institute in Guwahati, then MSc in Critical Care from Manipal. She has work experience at Fortis, Narayana Super Speciality, and presently she's at Apollo. She has been awarded the Best Nurse, Best Clinical Instructor, has been the 3rd topper in her post-graduation studies. She too has presented several scientific papers in both national and international forum, and presented also a paper in the Pan-Apollo Clinical Excellence for Critical Care on recognizing critically ill. She is an AHA certified BLS ACLS instructor, and she has also been awarded the Bright Beginner Managerial Role Award in 2022. So now we get on to talking a little bit about our, before I call on the panelists, it's very important to understand the entire environment of healthcare scenario in India. Now, India is actually in a cusp, in a state of cusp. It is in a state of health transition, and adding to the threats posed by the infectious diseases and antimicrobial resistance is the rising incidence of non-communicable diseases that have emerged as a leading cause of mortality. The social, demographic, environmental, and economic factors have contributed to this epidemiological transition. Moreover, the out-of-pocket expenditure on health and the high cost of healthcare force almost 60 million people into the poverty trap every year. Of the total healthcare expenditure in India, just a meager 9.6% goes towards preventive health and 90% goes on to treating diseases. And of this, close to 50% are for hospitalization for lifestyle diseases, and that too primarily in the urban and the semi-urban areas. The country's health infrastructure is overstretched and needs to be strengthened if it has to take on the challenges of the 21st century. And health equity in India too is skewed, and it is threatened by the health status of the poor, the female gender, the rural, the population in the rural areas, tribal communities, etc. So without further ado, I would like to ask the first question to Lovelen. It is very important for us to understand the milieu in which nurses are working in our country. So let us first try to understand what is the state of healthcare system in India. So Lovelen, would you like to answer this?
Yes, sure, ma'am. Just a sec.
You're in mute mode, Lovely ma'am.
Lovelen, we can't hear you. Yeah. I think you can unmute her. Vijay? Lovelen, you were muted. Yeah. Can you start? We couldn't hear anything.
1 second.
Yeah.
Am I audible now?
Yeah. Perfectly.
All right. So good afternoon and happy Nurses Day to everyone. So ma'am, answering your question, we all know that the healthcare system in India is a very complex and diverse system. We have public and private sectors, both extending from primary healthcare to quaternary care hospitals. And it is one among the largest and the fastest growing industry, serving the ever-growing population. Now we all know that we are at #1 in the world, and immensely contributing to the GDP growth and creating employment opportunities. So having said all these, still the overall state of healthcare in India is characterized by a number of challenges which impact the quality and accessibility of healthcare to the population. So coming to the challenges which the healthcare industry as a whole faces is the first is accessibility to healthcare. So one of the biggest challenges in India is the access to healthcare services. When we say this is more to the rural side. Many of them do not have access to basic healthcare services such as primary care, vaccinations, or emergency services. And the uneven distribution of healthcare services, as the name says, the rural-urban divide. So the healthcare services is mostly towards the urban areas, having better access to healthcare facilities and services. A significant proportion of the population living in India, in the rural areas of India, lack access to quality healthcare services. So this results in high burden of diseases and poor health outcomes in the rural areas. The third one is the healthcare financing or the limited public spending. The government spending on healthcare is relatively low, though it is becoming better now, which limits the country's ability to provide quality healthcare services to all. Then, as ma'am already mentioned, the increasing burden of non-communicable diseases in terms of cardiovascular diseases, cancer, etc., which require long-term management and specialized care. This is in addition to the load of communicable diseases we already have. Then the public health infrastructure is inadequate to deal with the challenges of the country. We face a shortage of healthcare infrastructure in terms of hospitals, clinics, medical equipments, mostly in rural areas. And the main one is the inadequate healthcare workforce, or which directly affects the quality of care provided. We have a shortage of qualified healthcare professionals, including the doctors, nurses, and other paramedical services. This can lead to poor care and even medical errors when we have less number of workforce. Then lack of insurance and high out-of-the-pocket expenses. A significant proportion of the healthcare expenditure is done by the individuals themselves. So this put a burden on the family or make them for financial hardship. Insufficient public health measures in terms of disease surveillance, healthcare regulations, or inadequate healthcare data management systems. So all these put actually the healthcare system, all this makes the healthcare system overburdened, and then which leads to long waiting times and poor quality of care. So these challenges have contributed majorly to a system which struggles to provide equitable, affordable, and accessible healthcare to all its citizens. So this addressing these challenges actually requires a combined effort from the government, private, and the civil society in order to improve the healthcare system's infrastructure, workforce, and funding.
Yes, Lovelen, I agree with you. And that's exactly what I said, that the healthcare services in the country is far overstretched because of various reasons, as you've already mentioned there. But it's also important for us to understand what is the state of nursing in India. And I'd like you to highlight some of these factors that impact nursing, growth of nursing in India. So would you like to just answer that question? That what is the state of nursing in India, and what is the role of nurse practitioners within the health system?
Yes, ma'am. So the state of nursing in India, as we are all aware that the pandemic has exposed the true nature of healthcare and highlighted the value of healthcare professionals, particularly nurses. So when we come to Indian scenario, the nursing education is offered both at the UG and the PG levels. So the auxiliary nurse midwife, which is a 2-year course where the nurses are prepared basically for the community health services. Then comes the GNM 3-year course where they are registered nurses prepared for hospitals and other healthcare settings. BSc nursing 4-year course, which prepares them as RNs and also put a basic for the research work. And then we also have post BSc where the diploma holders, if they want to upgrade themselves, it's a 2-year program. Then comes the Master of Science in Nursing, which prepares the nurses for leadership and advanced clinical settings and research. And we also have specialized nursing programs. So annually, if we say approximately there are around 2.5 lakh nurses, which passes out putting all these programs together. So this is the statistics from around 5,000 I.N.C recognized institutes. And if we say about the work setting for nurses in India, they primarily work in the hospitals, either in government, private, charitable, or corporate sectors. Nursing homes, they also work in home healthcare, which is another emerging sector in India. They get placed in schools and universities, in research facilities, in public health departments, and also in non-governmental organizations. Coming to the challenges which the nursing faces in India, the foremost is the shortage of nurses. So India faces a shortage of trained nurses. The nurse to population ratio is 1.7 as of August 22, whereas the WHO recommendation is 3 nurses for 1,000 population. Education and training, the quality of nursing education and training varies across the country. institutions lack necessary infrastructure and resources to provide quality educations, and of late there are students who never see the institutes and straight away go for examinations. Then the role of nurses in the healthcare is not often recognized. They are not often recognized as key members of the healthcare team, and many a times their contributions are undervalued. They are often burdened with tasks out of their scope of practice and are not given the opportunities to develop these skills. The working conditions, long hours of work, high stress levels, inadequate resources, and on top of that, many a times they're not adequately compensated for the work they do. Gender disparity, it's still been dominated by women who are often not given equal opportunities for career advancement and leadership. Less opportunities for employment that utilize the specialized skill. So it has not improved. It's quite challenging for specialized nurses to locate acceptable workspaces within the healthcare system. So many a times they have been bound to serve in poorly structured roles without acknowledging their qualifications and capacities, especially in clinical areas. So we can see only a few handful of institutions actually been supportive of the changing role of nurses in India. Then lack of funding for research. So though nurses have all these challenges, they continue to pursue their master's and doctoral degrees to increase the knowledge and experience, but they do not receive financial assistance most of the time and hardly ever receive grants for the to support the research. And all these actually lead to the brain drain, that they find opportunities in the international hospitals and then gets placed, better placed in there, and again leading to lack of trained nurses in India. So there's a need for strong advocacy for nurses at all levels. The gaps are multifaceted, and the qualified and leader nurses should be included in the core committees to where we should establish better advocacy for nurses to improve the state of nurses in India. Coming to the, you have put up a question for the role of nurse practitioners. So the role is still evolving. So nurse practitioners are basically advanced practice nurses who are trained to provide a range of primary and specialized healthcare services, including diagnosis, treating, and providing health education and counseling. As of now, the INC recognizes NPCC and NPM, which is critical care and midwifery nurse practitioners. Here also, we face a lot of challenges. The lack of clarity regarding the scope of practice of nurse practitioners, legal framework to what extent they can work, and limited access to training and education because it is still in its infancy stage. It's an evolving role. Lack of awareness among the public and the healthcare providers about the scope of nurse practitioners. Also limited recognition by healthcare providers and policy makers. So all these challenges actually may hinder or limit their integration into the healthcare system. Having said all these, despite these challenges, there is a growing recognition of the importance of nurse practitioners in the country. With the increasing demand for quality healthcare services, nurse practitioners actually have a potential to play a significant role in improving the patient outcomes and reducing the healthcare cost. So there's a need for continued investment in this program. As for nurse practitioners, the role is still emerging in the country, and it remains to be seen how it will be developed and expand in the coming years.
Yeah.
Thank you, ma'am.
Thank you. Thank you, Lovelen, for that very well you have captured the state of nursing in our country and the challenges that ails it and prevents in the growth of nurses. it's important to understand where the gaps are so that we could bridge that. So I would like to ask the next panelist, Colonel Elizabeth, to throw a little light on what we are all aware that the COVID had thrown all the health sector, the entire country and the globe out of gear, and causing unmitigated suffering for the humanity as well as for the impact on the healthcare workers, particularly the nurses and the doctors, was absolutely devastating. I think we need to capture that, since that is the reason why the ICN has prepared this theme of our nurses, our future. So maybe Elizabeth could throw a little light on how the COVID-19 has affected the nursing workforce globally and particularly in India, and what lessons did we learn from the COVID experience? Is Elizabeth there?
Yes, ma'am. Yes.
Yeah.
Good afternoon, ma'am. Good afternoon, ma'am. Thank you so much for that question. At the outset, good afternoon to one and all, and to Ma'am John. Happy Nurses Day to everybody. And I would like to sincerely compliment the AHPI, ANEI, and 12 Micro Labs for organizing such wonderful webinar series on the occasion of World Nurses Day. And my sincere gratitude to the organizing committee for keeping me as a member of this mega event. Thank you so much. On to the question that Madam has said. I just share my slide, ma'am. Is that visible?
Yeah.
Is it visible?
Put it on, Vijay, just put it on slideshow, please. Yeah.
Madam, you should select Elizabeth. Yours.
Yes, select.
Elizabeth, you could, yeah. That's
Yeah, ma'am.
Go on to the next. Yeah.
COVID-19 pandemic was not in sight when the WHO declared 2020 as the International Year of Nurse and Midwife, with a goal to raise the need for 9 million more nurses and midwives to achieve the universal health coverage by 2030. Neither WHO nor the nurses could have imagined how the profession would be thrust to the spotlight during a year of multiple health crises. The pandemic had caused the nurses have been on the front line, and ever since the beginning of the pandemic, no one could ever even imagine the impact of the workflow, our priorities, our expectations, and our resilience. This can be described in three phases. The first, we saw the impact of COVID was experienced in various phases. The first phase had shown or experienced the surge of patients with unknown knowledge, and all that the healthcare could do is involved in rapid scaling up of clinical and intensive care setting and stopping or suspending with the existing simple healthcare services, normal healthcare services. Phase 2 was an extension beyond the phase 1. Here, the main focus was on capacity building to meet the future demands of the pandemic waves and redeploy the resources that has been already established to handle the wave 1. However, we were left with a critical issue of fatigue and tiresome in staff, and supporting was a major issue during the phase 2. Phase 3 came to somewhere near new normal phase, which showed an improved public and private primary care services. It established various critical care units, and could also the medical system had to see for long-term care facilities due to the consequences of COVID on the people who suffered. And also it had to do a better integration between the acute care settings and hospital sector. The major problem that the nurses globally was affected was shortage of nursing staff. With a poor working condition and long time shifts, this already existing shortage with the additional burden of the COVID amplified the long-standing issues of burnout, and the high workloads and unprecedented levels of burnout further stressed especially the young ones who were brought to help out the surge of nursing manpower requirement, and insufficient necessary equipment, drugs, and PPE affected in the morale of the nurses due to poor quality care and dissatisfaction over poor outcomes of patient. Further, long-time quarantine periods after work, social isolation, and concern about the families were further causing stress and depression on the nursing staff. Sleep-related problems was intensified with immense psychological suffering and physical stress. They started feeling incompetent at their work because the work pattern totally was changed from what they had been doing. There was a fear of contracting COVID-19 infection among the nurses, and they also felt difficult in communicating with their near ones and with the patients due to the dress code and due to the restrictions of meeting that was imposed. WHO reports a global shortfall of 5.9 million nurses even before the pandemic. This pandemic further magnified and exacerbated the global nursing shortage, which caused occupational infections, stress on the nurses, burnout, and nurses have in addition also was facing physical violence and social stigma because they were working in infectious areas and had to be, was not permitted to meet their near ones or go back to home due to their association or close association with the COVID patients. It further shortage of resources was again an added stress to the patients. Working in infectious setting caused mental stress and fear of contracting. There was a negative treatment output, decreased the motivation and competency of the nurses, and many started leaving the profession due to the insecurity and the fear of infection and low wages. Hospital jobs became abruptly changed. Nurses had to self-isolate, and nearly 20% of the nurses at any given time had to be living in temporary housing that was provided by the hospital or made available by themselves. And professional development and training was also restricted, particularly, but they did feel little better after having developed a new knowledge of use of PPE and did that caring patients with the PPE and seeing the outcomes of the patients. Nurses suffered devastating health consequences. 13% of the nurses were also infected. Nurses found themselves caring for patients outside their realms of expertise, often with minimal training, and having a sense of mastery at work was the most protective against depression and anxiety. So they felt confident when they were able to care and find some good outcome in the nurse patients. A study showed that 43% of the nurses have developed more trouble sleeping than before pandemic. 61% feel more stressed during the pandemic working in the wards. Anxiety was found to be increased to 57% among the nurses. About half felt at any given time depressed or sad working and seeing the consequences of the patients under their care. And nearly 60% said they were fear about contracting the disease and infecting their family and safety of the family members. During the second wave, India did face highest mortalities and morbidities. Indian healthcare workers worked under very high pressure and stressful environments. And nurses working in COVID-19 designated hospitals reported clinically significant depression and poor sleep pattern. All that need to be done to improve upon us, assess and improve the working condition of the nurse, review and if necessary, expand the capacity of the nursing education and the nursing workforce, improve facilities for retention of nurses through attractive salaries and facilities, and implement and review policies which will stop them from moving out or leaving the profession. These were the major problems that the nurses globally and in India experienced.
Yes. So, Elizabeth, you rightly brought out the impact COVID had on the workforce, nursing workforce, and the healthcare workers in general. And it also exposed the vulnerabilities the nurses were exposed to. And as the theme of Our Nurses, Our Future, the ICN clearly mentions that we need to respect and protect the nurses if we have to use them adequately for the alleviation of suffering among the sick clientele. I'm reminded of what Lord Nigel, the chair of Nursing Now campaign, said, and he was a strong advocate for nurses. The biggest thing we can do is for health globally is to strengthen nursing. And in order to understand how the nurses and midwives can contribute towards achieving the universal health coverage, it is necessary to understand the key factors of the state of the world nursing report. Now, Vijay, can you please put it out, put on the, change this screen?
Yes, ma'am.
Can you change? Yes. And bring it on to the speaker mode. I think the slide share can be removed. Yeah, yes. So, as all of you know, that if we need to consider the future of nursing in India, it is very important that we consider two important documents. So I would like Elizabeth to continue with the state of the world nursing report. Just before I ask her to speak on it, I'd like to just put a preface to it. Now, the first ever State of World's Nursing Report, the SWAN report, was published in 2020. It was jointly published by the World Health Organization in partnership with the International Council of Nurses and the Nursing Now campaign. It provides evidence and policy options for the global nursing workforce and calls on making an investment in nursing, education, jobs, and leadership. It's perhaps the COVID must have driven the, WHO and all the collaborators to think hard how this huge 50% of the health workforce can be, strengthened in their capacity. So this report actually highlights the crucial and central role of nurses in strengthening primary health care, achieving universal health coverage, as well as sustainable development goals. And around the globe at that time in 2020, people started realizing, and perhaps for the first time, the true value of a strong, well-equipped, properly educated and regulated nursing workforce. So I'd like to ask the next question to Elizabeth. How does this State of the World Nursing Report impact the future of nursing in India?
Thank you, ma'am.
Put it on screen, slide mode. Yeah. Yes. I
Just started. Yes.
Yeah.
Just a minute, ma'am.
Hello.
Yes, ma'am. I'm just getting something.
We are able to see your screen, ma'am.
Okay. Just my screen is half covered. I'm just trying to rectify that.
No problem. I'll share it, ma'am. I'll share your
No. I'm able to share. Yes, I was just trying to. central role. We all before. Hello, can you hear me? Yeah. We all know that without nurses, no sustainable development goals or no universal health coverage.
Elizabeth, can you speak closer to the mic? Your voice is quite muted.
Can you hear me, ma'am?
Yeah.
Ma'am, we all know that there is no sustainable development goals achievement without the nurses, because nurses are critical to deliver on the promise of leaving no one behind and the global effort to achieve sustainable development goals. They make a central contribution to national and global targets related to a range of health priorities, including universal health coverage. No global health agenda can be realized without concerted and sustained efforts to maximize the contribution of the nursing workforce. State of the World's Nursing 2020 report was developed by WHO in partnership with the International Council for Nurses, the Global Nursing Now campaign, and wider partners which provides a compelling case on the value of the nursing workforce globally. Now, 191 countries participated, provided data for this report, an all-time high and 53% higher than compared to the 2018 data. The world's report provides the latest, up-to-date evidence on the policy options for the global nursing workforce. 2020 International Year of the Nurse and the Midwife was indeed an opportunity to leverage the evidence in the State of the World's Nursing 2020 report and to commit to an agenda that will drive and sustain progress to 2030. And they are: invest in the massive acceleration of nursing education by improving the infrastructures and other facilities, create at least 6 million new nursing jobs by 2030 to meet the nursing demands, especially primarily in low and low middle income countries, and strengthen nurse leadership both in current and future leaders. The summary of the report submitted by in the nursing report was: the first point was the global nursing workforce is 27.9 million, of which 19.3 million are professional nurses. This indicates an increase of 4.7 million in the total nursing stock over the period 2013 to 18, and confirms as the largest occupational group in the health sector, accounting for 59% of the health professions. The world does not give a global nursing workforce commensurate with the universal health coverage and SDG targets. Over 80% of the world's nurses are found in the countries that account for half of the world's population. The global shortage is estimated to be 5.9 million nurses, out of which 89% is concentrated in low and lower income countries, where the growth of the nurses is barely keeping in pace with the population growth. Aging health workforce patterns in some regions threaten the stability of the nursing stock. This is the finding again reported. Globally, the nursing workforce is relatively young, but there are disparities across regions with substantially older age structures in American and European countries.
Hello, are you there?
Yes.
You have any problem showing your slides?
Yes, ma'am. Little problem with it.
Let Vijay show it. He'll show it.
No, ma'am. No, ma'am. I'm able to.
Vijay, just show her slides, please. Yeah.
I'm doing it, ma'am.
You can go ahead.
Yeah. The aging workforce. And to address the shortage by 2030 in all countries, the total number of nurse graduates would need to increase by 8% per year on average. Without this increase, current trends indicate 36 million nurses by 2030, leaving a projected need-based shortage of 5.7 million, primarily in the Africa, Southeast Asia, and Eastern Mediterranean regions. Point 5 observation was majority of the countries, that is 97%, reported that the minimum duration for the nursing education was followed at 3 years. A large majority of the countries reported standards for education, content, duration, accreditation mechanisms, national standards for faculty developments, and interprofessional being maintained. However, it was less known about the effectiveness of these policies and mechanisms that was followed by the country. 78% countries reported having advanced practice roles for the nurses which can increase equal access and address disparities in access to primary healthcare for the vulnerable population. It is noted that nurses at all levels were enabled and supported to work to the full scope of their training and education, can provide effective healthcare and improve the healthcare services to the needy. It was found that 1 nurse out of every 8 practices in a country other than the one where they were born or trained. The international mobility of nursing workforce is increasing. While the patterns are evolving, equitable distribution and retention of nurses is a near universal challenge for all the countries. 86% of the countries have a body responsible for the regulation of nursing, of which 64% require an initial competency assessment to approve them to provide permit for working, and 73% nurses required continued professional development for getting re-affiliations. However, the regulation of nursing education and practice is observed, not harmonized beyond a few sub-regional mutual recognition arrangements. Regulatory bodies are also challenged to keep education and practice regulations updated and nursing workforce registries current in this highly technology-driven era. The next observation found was nursing remains a highly gender-based profession with associated biases in workplace. It is found 90% of the females are in the nurses are the females. There is some evidence of gender-biased pay gap as well as other forms of gender discrimination in the work environment too. Legal protections, including working hours and conditions, minimum wage, and social protection, were reported to be in place in most of the countries, but not equally across the regions. Just over a third of the countries reported measures in place to prevent attacks on health workers. 71% of countries reported having a national nursing leadership position with the responsibility for providing input into nursing and health policy. Both the presence of government, chief nursing officer, and existence of a nursing leader at the higher level is found to be associated with having a strong regulatory environment for the nursing profession. The future directions for the nursing based on the reports submitted by the World Report 2020 are: the first is to increase funding to educate and employ at least 5.9 million additional nurses. Both investment would be required to employ nurses upon graduation. Action has to be taken by the respective countries based on their facilities for improving the nursing numbers and supporting them in education and employment. Strengthen capacity for health workforce, data collection, analysis, and use. Accelerating and implementation of national health workforce accounts and using the data for the health labor market analysis will help us to guide policy development and investment decisions for the nursing workforce. The third suggestions given by this report is nurse mobility and migration must be effectively monitored and responsibly and ethically managed. Establishing and supporting the role of a senior nurse in the government will be responsible for strengthening and national strengthening the national nursing workforce, and contributing to policy decision and leadership programs. Planners and regulators should optimize the contributions of nursing practice. Policymakers, employers, and regulators to coordinate actions in support of decent work atmosphere by enabling environment for the nursing practice to improve attraction, deployment, retention, and motivation of the nursing force. It should also be the first choice for every person who opts for nursing. 8th suggestion given by the report was countries should deliberately plan for gender-sensitive nursing workforce policies by implementing equitable and gender-neutral system of remuneration and laws addressing the gender pay gap. The gender consideration should inform nursing policies across the education, practice, regulatory, and leadership functions, taking account of the fact that nursing workforce is still predominantly female, harmonizing nursing education and credential standards, instituting mutual education and credentialing standards, instituting mutual recognition of nursing education and professional credentials, and developing interoperable systems that allow regulations to easily and quickly verify nurses' credentials and disciplinary history was advised. Collaboration is ultimately the key to improve the nursing workforce, and the actions include intersectoral coordination with various stakeholders from the public and private sectors. Elements is to strengthen capacity for effective public policy stewardship so that private sector investments and educational capacity and nurses' roles in health service provision can be optimized and aligned to public policy goals. In India, strengths of the nursing workforce are many, yet they will be tested by formidable challenges that are already beginning to affect nurses, the health systems, and the organizations. It is advised engage right people on right place by increasing the number of nurses available to meet the nation's growing healthcare needs, place right clinical specialty distribution, and reach there by training and educating, ensuring a nursing workforce that is diverse and prepared with the knowledge and skills to address the social determinants of health, convert barriers to opportunities, and help to overcome current and future barriers that help affect in building the nursing workforce, and anticipate and act long-term impacts of COVID-19 pandemic and prepare workforce to face and care for these. Future nursing in India is we need to lift barriers to expand the contributions of nursing, design better payment mode to prevent brain drain, strengthen nursing education to attract more youngsters to join the nursing professions, value community nursing, foster nursing roles as leaders and advocates, prepare nurses to respond to various disasters, and support the health and well-being of the nurses. Future of nursing in India is indeed, we all know, is robust because we have a well-recognized training system, have a regulatory bodies very strong at the center and state level. We have a clear-cut licensure policies both at the center, state, and at specialized levels. We have leadership and voice at national and state ministerial levels where they are able to be raise or give a voice for decision making. The profession is totally not gender biased. Men equal opportunity is given for both the men and males and females, and our regulatory bodies are fairly modernized as per the technology development. Therefore, nursing in India is much ahead of the situation that the world is facing, and compared to the observations raised in the World Nursing Report 2020 and the suggestions given by the report. So this report has provided robust data and evidence on the nursing workforce. This intelligence is needed to support policy dialogue and facilitate decision making to invest in nursing to strengthen primary health care, achieve universal health coverage, and advance towards sustainable development goals. Despite the signs of progress, the report has also highlighted key areas of concern. Thank you, ma'am.
Oh, thank you, Elizabeth, for that very elaborate overview of the SON report. Yes, the SON report has aptly brought out the global shortages in nursing workforce, which is not enough to achieve the universal health goals and the sustainable development goals. And you have brought out how nursing globally as well as in India can be strengthened by creating the right skill set, the right knowledge base, the right environment, the other aspects of remuneration, gender, equitability, etc. And now I would request, as we are running short of time, I'll now request the last speaker to just give an overview of the impact of the WHO Global Strategic Directions for Nursing and Midwifery 2021-2025. Without mentioning this document, we will not be able to understand how the future of nursing in the world as well as in India can go through. Now, this document was requested by to the WHO to engage with all the other WHO regions. The World Health Assembly had directed the WHO to involve all the WHO regions to update the global strategic direction for nursing and midwifery in consultation with the member states and submit the report at the 74th World Assembly. Now, just to give you a brief description of this document, it actually presents evidence-based practices and an interrelated set of policy priorities that can help countries across the globe to ensure midwives and nurses are optimally contribute to achieving the universal health coverage and other population health goals. And this policy of this strategy involves 4 key areas, that is education, jobs, leadership, and service delivery. Without eating into the time of Karishma, I would now request Karishma to just tell us how can this strategy transform the future of nursing in India, and what steps has the government of India taken to strengthen the capacity of nursing in India. Over to you, Karishma.
Thank you, ma'am, for that. I'm actually privileged to be among these panelists, and with wholeheartedly, I would like to wish everyone a very happy International Nurses Day 2023. Such a beautiful theme given by International Council of Nurses in 2023. The theme itself denotes the responsibilities of each nurses today. The theme itself is a question to us, a thought which has to be injected in every nurse's mind today. The future of anything we are not aware. However, we need to work in such a manner so that we can prepare ourselves for tomorrow. I believe that's what ICN wants us to do. When I myself think about the future, I often ask, where are we heading? We need to deep dive into it, taking all the risks and challenges, because we have acquired the basic skills and knowledge of nursing. However, is this all enough to have a better future or to transform the future in nursing workforce? So, as both the speakers has mentioned about COVID-19 pandemic has put the entire spotlight into this workforce. And although we had different kind of challenges, different kind of heartbreaking news, we stood tall and we dropped there as a star. So opportunities are plenty. We need to grab, as ma'am has also mentioned about the state of world report. So many opportunities are there. The door is open. One need to work on the path created. The success is in the next step. We need to take a leapfrog to reach there. The pandemic has taught us how to be prepared for anything upcoming. We need to learn from the lessons of the pandemic and translate those into actions for the future that ensures that nurses are protected, respected, and valued. With these all things, I would like to ask myself and to my fellow members, are we ready for the futuristic needs of our patients? Although reports has been given, evidences has been given, are we ready to handle the upcoming digitized healthcare world? Are we also ready to take the social roles and responsibilities beyond bedsides? Is our mind ready to face the upcoming challenges and find solutions? Are we ready to face the healthcare revolutions? So I feel and believe this is the high time to find all these answers by ourselves, and we nurses have to work for our future. Although policy priorities have been given by global strategic direction of nursing and midwifery, but need to execute those to see the transformation in the future. As Man has already mentioned, the global strategic direction for nursing and midwifery 2021 to 2025 by WHO has mainly focused on 4 areas, that is education, jobs, leadership, and service delivery. Nursing and midwifery profession can transform the way health actions are organized and how healthcare is delivered if they are regulated and well supported. There are leaders, organizations who are continuously onto it, continuously working on upgrading the nursing services, reforming the policies and protocols. However, as a nurse at the ground level, we need to execute those by putting it into action and also by owning our professions. Moving forward, let's see in the education and how it is transforming our future. We always think of when talking about theory and practice that there is always a gap in between theory and practices. ADGMNS has prioritized many policies to enable these directions into actions. So ADGMNS policy priorities are going to help us to fill this gap between theory and practice. Because the policy priorities are towards the upgradation of education credentials, which is already evident by government initiatives. To mention, in 2021 to 2022, 30 billion has been allocated by government towards healthcare, which is huge rise, that is 137% increase from previous budget. Also to mention, 1.8% of GDP has been given to healthcare only. Ma'am, anything?
No, continue.
Okay. In the Ministry of Family Health, Ministry of Health and Family Welfare mentioned that nursing education budget has increased from 789.6 crore to 1,283 crore in 2020 to 2021 after we adopt SDG 3 goal. And also very happy and significant improvement in 2022 and 2023, that is 1,507 crore budget has been put only to nursing educations. Also in 2023 budget, 157 nursing colleges has been announced in our budget by Finance Minister as per the Economic Times. And 10 crore is given to each medical college to set up a new nursing college so that we can have different cadres of nursing education, skill-based education programs. Even Indian Nursing Council also has started already all those initiatives by starting nursing practitioner course, as Lovelen ma'am has mentioned, and also competency-based education, skill-led establishment in different parts of the country. These policy priorities are putting the shades into few points, like we need to invest in digital technologies and infrastructure because we cannot be behind as the world is moving towards with digital technologies development. We can also have a mentorship program. We can also have a faculty training by some clinical expertise so that students can be learned better during their student period and they can be absorbed directly into the service delivery system for universal health coverage. Positive side can be also seen as a government has taken already many initiatives to increase the medical colleges, as we have seen so many AIMS medical colleges been already established. And being at Assam, I'm so happy to say that even in Guwahati, we are coming with AIMS and adjacent to the nursing college. And there has been evidence of more number of students enrolled in nursing in recent few years, providing financial incentives and also to students scholarship to students are also given. So these are in the sector of education. Moving towards in the jobs, SDNM policy priorities are towards attract, recruit and retain midwives and nurses where they are most needed. Ensure adequate demand with respect to health service delivery as per the current need of the hour. Nursing workforce planning and forecasting through a health labor market. And also implementation of WHO Global Code of Practices on the international recruitment of health personnel. Although there is no magic to retain the nurses in any organizations, however, this policy priorities has given some ideas how to retain. As I'm working at Apollo, so I'd like to share this. On this day, auspicious day today, our chairman announced and launched one program that we in the organization should help the nurses for career coaching. Like our nurses wants to go to abroad, why not we give them the educations like IELTS, OET, and nurses will be better learning. Like they will learn, they will earn, they will excel in this setup, and they will settle somewhere and they will return. So this is the discussion we are having today to attract the nurses to the bedside, and also by this we are going to retain them where they are mostly needed. When we talk about ensure adequate demand, as second speaker Elizabeth ma'am was mentioning about, even Lovelen ma'am was mentioning about the fund allocation, which is a drawback. So here, creation of different job opportunities in different cadres, like Sir Girdhar sir also has mentioned that even if we do GNM, BSc, NMC, staff nurse remains in the staff nurse. So creation of different jobs. Again, we can think of in the bedside nurse, different positions identification, like to mention few: nursing officers, assistant clinical nurse, deputy clinical nurse, senior nurse administrator, nursing specialist, clinical nurse specialist. So these are the different kind of job designation which can attract and which will draw the attention of different nurses force as per the need. And also they have mentioned about health labor market. This health labor market gives us a comprehensive understanding of the data which is available both in employment and the educations. To mention few, this also gives the idea of shortage and surpluses, skill mix, and geographical imbalance. So data and stock and distribution, we came to know if we have a health labor market analysis, these are very essential to develop the effective health workforce policies and to plan for future. When we talk about implementation of different codes in view of nursing manpower, this will also help in health emergencies, and implementation of code will help us to manage the health emergencies to support the universal health coverage rather than compromise. So in the job, these are the policy priorities, and few actions to enable this or to execute these policies are legislative and administrative social protection. A nurse as a workforce should feel that protection while she is in work. Additional budgetary allocation, sustainable wage bill expansion, optimized scope of service. Scope of service should be defined, or it is now defined as we are in the clinical field, and we have seen that scope of practice has been defined, privileges has been given, competencies has been done on the different cadres of nursing positions, which is really helping in transforming the future of nursing force. As I have said, there is no magic to retain the nursing staff in few positions of few organizations. However, there are some bundle retention policies which is talking about education. As I have already mentioned, we can have different kind of educations which will help the nurses to prepare for their future, prepare for their upcoming job opportunities. There can be regulations which will support them, which will protect them, license and everything. There can be incentives in different methods. There should be personal support and professional support to retain the nurses in the area where we need them most. We can also consider a rural pipeline of students. While teaching the students, we can teach in such a manner that they become competent with all the skills by using all those skill-based learning. Can directly absorb them in the service delivery organizations instead of, as we have seen nowadays, majority of the fresher, when they come to the hospital, they spend their time learning, and when they learn and they just they aspire to go some other job and profession. So if the students learn during their student time, we can directly absorb them for the service delivery organizations, and they can do better. Also, zero tolerance policy for workplace violence. We are very proud to say that in today's generation, there are different policies in organizations. If I have to mention few, ICC committee, grievance advisory committee, and there should also, as we follow ESCA, that is emotional support to when a nurse or any this workforce makes some incidents. So we need to support them emotionally, so that they do not become second victim. So these kind of policies existing in any workplace will help us in this job sector, and it will definitely transform the future if we work on in this manner. Moving forward to leadership, we always look for a leader who invests, who inspire, and who influence. Strategic direction for leadership says increase the proportion and authority of midwives and nurses in senior health and academic positions. As we have seen last slide, Elizabeth ma'am's slide, that there are senior positions are available, however, the empowerment. So this is a lacking of nurses, which evidences has been found. So if we can deploy the senior nurses in the senior positions of healthcare so that they can collaborate with other stakeholders to take some strategic decisions for universal health coverage. So this will definitely transform the future of nursing force. So also to invest in leadership skill development, SDNM policy priority says that enabling different fund and budget to this leadership so that continuous leadership skill development program will go on and can develop the second line as the leader has to work the top. So she has to create the second line that anytime any position vacant in the senior positions and so that it can be grabbed easily. And there should be some reward and recognition program so that younger nurse attention comes to this point and they become motivated to be in this profession, to work for the future, how we require and as per the healthcare demand now. When we talk about service delivery, strategic direction by SDNM is midwives and nurses work to the full extent of their education and training in a safe and supportive delivery environment. So there are many factors which can help to develop this safe and supportive service delivery environment. These are regulations, as previous speakers has nicely mentioned. There should be some quality assurance mechanism to monitor or to assess those performance of regulators and the efficiency and effectiveness of regulations. When we talk about regulations, if some strict regulations are there, it can facilitate the efficient recruitment of qualified midwives and nurses into the active workforce to increase the quality health services. When we talk about the utilization of competencies as per the specialties, so there should be some scope of service, there should be some job privileges, and as per the specialties, we need to utilize the strength of nursing manpower. And I definitely believe, and if we utilize this, the strength where we need to use, it will definitely transform the future of nursing workforces. There should be, we also should look into occupational health hazards. As an example, if one of the nursing manpower of that workforce becomes sick, or example, pulmonary tuberculosis or something, we can definitely think of redeployment of the staff in the area where she can, make like example, telehealth services. If a nurse cannot work in the bedside because of her health condition and all, this SDNM also mentioned about telehealth services or like that, many other services where nursing workforce can be utilized in an efficient manner. So this is about service delivery. I know the time is running short, that's why I'm moving a little faster. Coming to the, I have included all these jobs, leadership, service delivery in education. So now when we already have all these opportunities laid down, policies have been laid down, protocols have been laid down. So now it is our job. That's why I feel the theme is our nurses, our future. We need to work for our futures. We need to gear up in moving the future in such a manner that universal health coverage can be achieved by a major contribution of these beautiful professions. So we need to move towards professionals. When we were talking about skill, we need to be visible from the invisible. We need to take out the valuable personalities from the invaluable. We could walk to the boardroom from the bedside. with different cadre of nursing positions. There is no more time to be timid and getting scared. We need to speak up. We need to be fearless. With our attitude, these all things would come up. We need to stop being echo, rather we should be a voice. I believe and I truly trust that if every nurse voice can come, and definitely we can transform the future the way it is required by today's healthcare demand. We need to think out of the box. We need to really accelerate our speed in such a manner as healthcare system along with digitalization system are moving like a bullet train. We need to reach there while moving faster and faster with upgraded knowledge, skills, and also research. So I would like to say the past is your lesson, the present is your gift, and the future is your motivations. So with the motivations, we need to work faster. We need to keep going. And thank you for patience listening. I'm little fast because I know the time is very constrained for me. And thank you so much for giving me these opportunities. I'm really honored. And thanks to Annie. And because I'm an ANEI member, again, I realize the opportunities we get so many and we need to grab, but opportunities will come in our way. If we let it go, it will never come back to us. So in this manner, I feel we can really transform the future of nursing India as well as entire globe. Thank you so much, ma'am.
Thank you. Thank you for that wonderful brief outline of how the document can influence and impact the future of nursing. Just to capture all that we had been speaking for almost an hour now, more than an hour, is that we have journeyed through the healthcare system in India and what ails it, the nursing state in India, and how the two documents influence and impact and what needs to go forward. Just to summarize the whole thing, that as nurses, we need to reflect on these 6 C's in nursing practice. And that is care, compassion, courage, communication, commitment, and competence. And this is not possible without giving adequate quality training, good working conditions, autonomy, nursing positions, good salary package, etc., which has already been spoken by the last panelist. Now, for this to happen, the government of India, the state governments, the professional associations, consumers, employers, nurses, and all professional counterparts, funding partners should collaborate, coordinate, cooperate, and make a commitment for improving and nursing, raising the standards of nursing education and practice, empower nurses to make significant contribution to achieve the SDG and the UHC goals. Now, in relation to this, what the initiative the government of India has taken is that they have launched the nurse practitioner in critical care and the midwifery practice. They have also launched, the I.N.H.S has launched a leadership program. The bill I.N.H.S would come under a nursing bill, which is awaited to be passed. And as many of you have, all the 3 speakers said, there have to be better positioning. Dr. Girdhar also mentioned you need to have more career progression, both laterally as well as vertically. So there's a lot needs to be done, and the government and a partnership with all these associations are at it. And we hope that nursing will have a fresh blood and a better future tomorrow. So in conclusion, I would just like to thank all these panelists for their inputs, and just to capture this whole thing and how this would impact in the decades to come. We will require a stronger, more diversified nursing workforce that is prepared to provide care, promote health and well-being among nurses, individuals, and communities, and address the systemic inequities that have fueled wide and persistent health disparities. The nation will never fully thrive until everyone can live the healthiest possible life. Promoting health and well-being has always been nurses' business. Thus, it is very essential to harness the vast experience and untapped potential of nurses at every level and in every setting to build healthy communities for all. Thank you so much for your patient listening. So we are happy to take, if there is any question from the audience, we would be most happy to take it. I can see in the chat box that nobody has posted any questions, but I don't know whether Vijay has got any.
No, ma'am. I think in the time being constrained also, I think it were exceeded after.
Okay, yeah.
That is.
So we can skip the Q&A then?
Yes, ma'am.
Yeah.
So, in fact, what I gather across, I mean, the lot of activities are happening around the hospital on this International Nurses Day. So keeping them also quite occupied. But nevertheless, the entire session is getting live recorded. So which will be having access to all the nurses over our platform, the YouTube platform. So that's going to be really useful to them. And I'm sure this can be re-telecasted at their own convenient time later.
Yes, that'll be.
Yes, ma'am. So before I go for the thank you note on behalf of the International Nurses Day, once again, I take this opportunity to wish all the nurses who have joined us, who have spared your valuable time. So I would like to play a video that has been created on the occasion of this International Nurses Day. So can I play it, Vijay? So thank you, all of you. I think, ma'am, nurses play a very key role in our society. We remember every noble act on this special day. Thank you just doesn't seem all that you not only do.
We've lost link.
Yeah.
Your internet is not stable, I think.
All right. Okay. Can you hear me now?
Yeah. Now we can hear you.
I think nurses have a gift that many of us do not, and strength that most will never have in our lifetime. As the saying goes, you have the hands that turn caring into action, touch that turns compassion into comfort, and smiles that turn love into healing. Truly, this is the art of nursing. It is our pleasure to have the panelists, Colonel Dr. Elizabeth M.B., Ms. Lovelen Sunil, Ms. Karishma Khaund, and our moderator, Major General Elizabeth John, for their insights on today's the theme, our nurse, our future, the ICN theme of 2023. So we take this opportunity to thank all of them wholeheartedly for sparing their valuable time, ma'am. So thank you very much from the bottom of our heart. I also take this opportunity to thank all the panelists who have joined and shared their valuable insights. I think truly we salute all your valuable time, ma'am, and I'm sure all these messages would be going across all the nurses, spread across globally, and I'm sure each one of them is going to have their own touch points and carry a message on this today's important occasion. I also take this opportunity to thank the AHPI as well as ANEI, Mr. Dr. Girdhar, Gyani, Dr. Alexander, as well as ANEI's president, secretary, the entire team have been so supportive in identifying the right speakers, right topics for these 7 days of webinar. I think this has been truly one of the best of the programs, probably what we could have done over the last 3 to 5 years, which although we tried to do it, but this time there's so quality in all the talks as well as the entire telecasting have been so good. The kind of feedback we have been getting from various hospitals is quite encouraging. So on behalf of entire Microlabs, I once again place on record the thanks to the entire team of AHPI as well as ANEI. So thank you very much once again. And not the least, yes, we'll be more than happy. Microlabs and AHPI along with the ANEI would always be glad to extend our support to our Nightingales as an ongoing efforts to build promising career in India. We salute your services for the humanity and pray for the well-being of you and your family. Thank you once again, one and all of you, and a happy Nurses Day. Thank you.
Thank you. Thank you so much. Thank you.
Thank you, ma'am.
Thank you, ma'am. Thank you, Elizabeth.
Thank you.
Thank you, Vijay.
Thank you, ma'am.
Thank you, Vijay. This Dr. Girdhar.
Thank you, ma'am.
Thank you
Vijay.
so much for your kind words, Mr. Raja. And
Thank you.
today, I think less people have come, and all these panelists are all involved in nurses' activities. So they must be
Yes.
sitting pins and needing to go back to their hospitals or colleges, wherever they are.
Yes, ma'am. Yes.
Yeah. Thank you so much.
Thank you, ma'am.
Thank you, ma'am.
Thank you so
Bye-bye.
much, ma'am.
Thank you, ma'am. Thank you,
Bye.
ma'am.